Bridger Clinic is committed to providing reproductive and related health care in a setting which respects the dignity, well-being, and privacy of each individual. We also provide educational programs that enhance information and understanding about sexuality and reproductive health. We've been in Bozeman since 1972, and we are the only private nonprofit Title X family planning clinic in Montana. Its primary focus was to ensure access to family planning services to people who would otherwise have difficulty affording those services, and that remains our primary focus. We're able to pass on savings to our patients by providing them services on a sliding fee scale based on their income and household size. It's extremely important to us and to patients that we deny services to no one based on inability to pay.
I'm Mary Pat, and I've been going to Bridger Clinic since I was a college student. Yes, the sliding scale was also something that was really important, especially to a young person if they don't have health insurance. Even older people who don't have health insurance, you can come here and know you're going to get a service and you're going to pay what you can.
So when I first started coming to Bridger Clinic, I was a graduate student, was working seasonally, and I used the sliding fee scale, and it was a great service that they have in this community to be able to afford to come and get contraceptives at an affordable price and get healthcare basically at an affordable price. Even though now that I have a real job and I could afford to go to a private healthcare provider, I have health insurance, I still choose to come to Bridger Clinic because I enjoy coming here. I like the providers here. I like the service and the comfortable atmosphere I get here. And I like providing, being able to pay for services that I know maybe my money is going to go help somebody else who couldn't pay for services elsewhere.
Federal and state funding makes up about a quarter of Bridger Clinic's overall operating budget, and the remainder of fees come from patient fees, patient donations, fundraising, and contributions from the community, and some private funders. About 2/3 of our patients live at incomes that are at or below the poverty level, and they're eligible to get services that are typically on a donation basis or at the most 25% of our full fees.
The primary mission of Title X clinics like our clinic is to help women and men avoid unintended pregnancy and postpone parenthood or expanding their families until a time when they are emotionally, physically, and financially able.
Part of our work in the clinic is really helping women and men find contraceptive methods that they are comfortable using. Most of us will use a variety of methods during our reproductive lives, and we hope to be able to guide people to choose a method that will work well for them at this time in their life.
What I usually do with clients, I sit and talk with them about their birth control needs, and we also do talk about natural family planning.
A very big part of what we do is to do birth control method counseling and to prescribe and provide all forms of reversible contraception.
At Bridger Clinic, we also offer free pregnancy testing for our clients, and we want to make it free so people don't feel that's a barrier to coming in and finding out if they're pregnant, because pregnancy, the sooner you find out, the better it is for the person in order for them to make their decision. And if they're going to continue their pregnancy, they can start prenatal care. The options being, parenting, continuing the pregnancy, placing for adoption, or termination, abortion. We talk about all three options here. And we kind of let the client lead that. Some people know they want to parent, some people know they want to have a termination, and some people really aren't sure what they want to do, so we will discuss all three options with them. I'll also discuss with clients about what their family planning goals are when they would like to start a family, and often try and gear their birth control needs to that.
Our clinic is privileged to be able to provide reproductive related health care to both women and men from teen years through older adult years. It's really very important in our clinic that we be able to provide that care in an environment that is respectful to our patients as well as safe and confidential.
My name is Ryan. I live here in Bozeman, Montana, and I've been coming to Bridger Clinic for about 2 years. You always think of Bridger Clinic as a women's clinic, and one of my friends one day suggested that, or at least mentioned that it's for guys too. So my first time I did finally come down and get checked out. I was really nervous, but all of the tests were painless, and that was a big relief for me.
Clinicians at Bridger Clinic provide exams that are routine annual exams as well as problem-focused exams. Some of the services that we provide are pap smears, breast exams, testicular exams. We order mammograms and blood work. We offer sexually transmitted infection testing and provide treatment. We offer rapid HIV testing, and with new technology, those results are actually available in 20 minutes.
Over and over again, we hear on our patient satisfaction surveys that patients are not sure where they would access care if we were not available.
And it's always very reinforcing and encouraging to me and the rest of the staff when many of the comments relate to the fact that we have provided care to a particular patient for X number of years and they don't know what they would have done without us. It really makes it all feel very worthwhile.